Good evening, everyone, and welcome. You know what? We're going to be talking about urine analysis and understanding what that looks like. So I have Dr. Udani here with us today. She's our naturopathic doctor here at Justine Blainey Wellness Center, and she is going to go over all of the ins and the outs of what happens when they look really closely at your urine. Dr. Udani, you are welcome to start.
Thank you so much, Angela. Hello, everybody. Good evening. Thanks for joining us. So your analysis test, you might have done this many times, as a regular checkup. And this is, a test to check your urine to see, to assess your kidney function. Okay. So, and sometimes you might have done this too, because you had symptoms of a urinary tract infection, the burning sensation, the need to go urinate every time. So whenever you have those symptoms too, we might run a urinalysis just to see what's going on. So in a urinalysis, what we're looking for is, we're looking for three things, okay? So we're looking for the physical look of the urine. So is it too dark? Is it too light? Is it cloudy? Because that can also help us figure out what could be going on. And then we also do a dipstick into the urine. This is where, well, for the most part, these tests are done in the lab. And but as a naturopathic doctor, I can do the dipstick test here, but the chemical test, we can't do it. So I just want to let you know about that. So the second test we would do is a dipstick, which helps for us to figure out some properties in urine, which I'll talk a little bit more. And then a more comprehensive chemical test can also be done to see if there are bacteria living, there's yeast or any like crystals that are complex that are formed that could signify kidney stones, and also immune cells as well. So these are the three tests that we look out for when we do a urinalysis. So we look at, just to recap, we do a look at the urine itself, the color, how it's looking, is it cloudy? And then we look at we use the dipstick to see the other properties. And then we also do a chemical analysis to show more in depth about the immune cells and things like that. So what kind of color really let us know? So if it looks a little bit too dark, like brown or reddish, and that could mean that there is some blood in urine. And that is a no-go. We do not want to see that because that can indicate some kind of trauma to the kidneys or the bladder, or could also indicate a urinary tract infection. Okay. And sometimes, this is not really visible to the naked eye. And that's where we want to do a more specific test, like a chemical test later down the road, just to kind of rule those things out. Then we also look at to see, does it look cloudy? Because if it's cloudy, the chances are there is probably some bacteria growing in there, and there could be a urinary tract infection. So even if you don't have any symptoms, you can still have an infection going on. And if we don't look at it and catch it before we catch it and then we stop it, it can grow all the way up to your kidneys. So this is why getting your analysis test done, as a regular checkup can be really, really helpful. Then we also look at the volume as well. So is it enough, or has it not been, is it under the normal amount of urine we should see? Usually when we collect the urine, it's ideal if you do it the first urine in the morning, and you want to collect it midstream. And that's because when you first urinate, you want to flush out any excess bacteria or any kind of toxins that are kind of hanging around. And then catching it midstream gives us the most accurate information on what's in the urine itself. Okay. And you don't need to really fast for this urinalysis test unless you're also going for other tests like checking for your cholesterol or your blood sugar. So in a urinalysis test, when we do the dipstick method, which is where we insert this little stick that has different markers for example, protein, for sugar, for immune cell enzymes, for the pH, and for the color, and all of those things. So when we insert it, all of that, there's the different markers will be either over or normal or under, right? So we can check from that to see, is there presence of protein in the urine, or is there presence of sugar or ketones or in glucose in the urine? Because you should not really be seeing any of those in the urine. So if your kidneys are working well and it's doing this job, you shouldn't really be seeing any protein or sugar or protein or sugar, and also immune cell activity in there. Okay, so any of those could signify pre-diabetes or diabetes or kidney disease or some kind of urinary tract infection. So this dipstick method is a really quick way to figure out what's going on. And then we might do a chemical reanalysis to figure out a little bit deeper. Okay. So what a urinalysis really helps us to figure out is, how are your kidneys doing? How is your urine? Are you hydrated? Are you dehydrated? Is there too much protein in your body? And what can we do from that? And of course, is there a urinary tract infection that could be going on that could be causing inflammation? Okay. So urinalysis is a great test that should be done regularly to make sure that your kidneys are staying healthy and safe. And as a naturopathic doctor, I can do a dipstick urinalysis, which is where we check for, the protein. Is there any glucose? Is there signs of an infection in the urine? So if this is something that you are interested in doing, you can for sure meet me for a meet and greet. That way we can discuss how is this done. Okay, so hopefully that was helpful for you to figure out the ins and outs of urinalysis. Is very simple test that can show a lot of different things about what's going on in your body, because as the kidneys, they're very important organs that flush out a lot of toxins, and it's important to make sure that they stay healthy, and as much as possible that we try to be proactive about kidney health. All right, I hope that was clear. And if you have any questions, you can always give me a quick text, send me a text, or look at me and talk to me at one of the meet and greets. You can book through reception as well. And I'll just give you my phone number is 905-840-9355 to book a meet and greet. And also, if you want to send me a text, it's 437-702-2112. All right, I hope you had a wonderful time and that you learned a lot from this video. It's a short video because we're just talking about one test, but stay tuned because we will be posting more about different blood tests and the different markers on what is normal and what is not normal. And so stay tuned for that talk as well. Have an amazing night, everybody.